Hello, everybody, and thank you so much for joining us for this evening's webinar, Supporting Early Childhood Trauma with Occupational Therapy. My name is Catherine, and I am the Community Engagement Liaison with Interwoven Connections, formerly known as Adopt for Life, a community that represents the tapestry of families, and relationships formed through adoption, kinship, and customary care, creating spaces and experiences where parents and caregivers feel seen and heard. We are so very honored to have you join us and learn from Heather and Tanya about how OT can help support healthy development and address the impacts of early childhood trauma. Now, before I share how we're going to be using this platform and formally introduce to you our guests, I would like to pause and acknowledge the lands that we are situated on today. I understand that we're coming from various places on Turtle Island and actually from around the world, so we learned. So I do ask that you take time to just reflect on your own personal territory and treaty. I personally reside in the traditional territory of Anishinaabe, Huron-Wendat, Haudenosaunee, Ojibwe, and the Mississauga of the Credits people within Treaty 19, that's now home to many diverse First Nations, Inuit, and Métis people. Land acknowledgements are a small but important step in recognizing the historical and ongoing impacts of colonization on Indigenous peoples. They remind us of our responsibilities to learn the histories and cultures of First Nations, Métis, and Inuit peoples, and to reflect on how we can contribute in our own ways for a just and equitable future. In the words of Anishinaabe elder and educator, Edna Matnawabi, being an ally means more than just acknowledging the land. It means standing in solidarity with Indigenous peoples and their struggles, listening deeply, and taking action to support their rights of self-determination. We do want this to be an engaging and interactive webinar. As you can tell, we're very friendly people. So please feel free to use the chat feature for anything you want to say. If it's tech related, if you want to share comments or engage with some of the content, we do invite you to use your closed captioning feature if you'd like to enhance your understanding of the audio content or to accommodate any hearing needs. We are fortunate enough to have a designated Q&A at the end of this webinar, at the end of this chat. So we ask for you to use the Q&A feature, which you can use throughout the entire webinar as things pop into your mind. And you do have the option of asking anonymously if you prefer. Please note that we do have quite a few participants who will be joining us, so we might not be able to get to all of your questions live, but the good thing is that I know how to get a hold of both of these amazing ladies, so we'll make sure to follow up with any answers, as well as I will be following up with a copy of this recording and any other relevant materials. So without further ado, I'm going to introduce our presenters. Heather Hodgins-Chan is a registered occupational therapist with over 25 years experience supporting children and their families from infancy to young adulthood. A co-founder of On the Ball Pediatrics Physio and Occupational Therapy in Canada, she specializes in sensory processing, trauma, and attachments, focusing on these impacts, both physical and with mental health, Heather also practices at the Ottawa Centre for Attachment and Trauma Therapy, where she collaborates with the physiotherapy team. Known for her attachment-based trauma-informed, that's a mouthful, approach, she uses playful, sensory-rich activities to help children self-regulate and express themselves, with an emphasis on involving parents and caregivers in the process. Whew, I made that one. Okay. Overall, she's just an amazing person. I should have just
totally
put that.
Totally true.
Tanya is a psychotherapist specializing in early childhood trauma, attachment complexities, FASD, and neurodiversity. As an adoptee herself, Tanya brings unique empathy and insight into her work, supporting youth and families on a complex journey. You also have a lot of big words. She is trained in didactic developmental psychotherapy, polyvagal therapy, nonviolent resistance, focusing on approaches to support families facing challenges like AFCCA. You can learn more about AFCCA as well by going on our website, although I'm sure many families who are joining us probably already have heard this term. She's based in Ottawa, and she's also launched the Ontario's Fetal Alcohol Resource Program and has served as a key FASD key worker in British Columbia. Tanya is a mother of 2 and a stepmother, bringing both professional and personal experiences to her practice. My goodness, I stumbled through that. I apologize. You both are amazing. I appreciate everything that you're doing. I think you just get more experience just to try and trip me up in what I'm saying. That being said, I'm going to go ahead and turn my camera off. I'm going to be here, so if there's any tech issues, I'm going to do my best to help support. And then I'll pop up in the end to help moderate any Q&As. So I will turn things over to you lovely ladies.
Thanks,
Thank you so
Catherine.
much.
Okay, what do you think? Should we put the slides up now or just start chatting?
Let's just start chatting.
Okay, I'm good. We can do this. This is easy. So I've known Heather for quite a few years now, and I got the privilege of working with her, and we've actually worked together with clients before. So I've seen her work, and she's pretty magical. It's really fun watching Heather work, and that's why I wanted to bring her in, because not only just does she know about FA or about occupational therapy, but she just is really good at it, especially with our crowd. So
Thank
I,
you, Tanya.
yeah, I thought I was thinking about, well, actually, a lot of times when I'm working with families, we suggest that they think about OT for their kids, because I think OT can be really, really useful. And a lot of people don't really have a strong understanding. So that's the real reason why we decided to do this, was just to give more of an understanding about what OT is, what you do, what you can do, what people need to look for. So I'm going to we put together some questions, and we'll just go through some of the questions and see how that goes.
That's
So
great.
first of all, I think the big question is, what is an OT, or an occupational therapist? Because I can honestly say I've been working with occupational therapy for, I was thinking about it, like well over 30 years. And and I would even still be hard pressed to really define it well. So how about you define it for us?
Well, you know what? You're not alone. So a lot of people don't really know what we do. And I think it is because that in school we're trained in so many different areas. So it can make it very challenging for people to understand. So occupational therapy, the first thing that people think is that, oh, we're going to get you a job, or we're going to get you back to work, which is we're not going to get you a job, but we are going to help adults get back to work. However, so like occupations are the things that we need to do on an everyday basis, right? We need to get up, get out of bed, move around, go get our breakfast, you know, prepare breakfast, eat it, get ready for school. This is in, reference to children. So we're looking at the daily occupations that children have to go through in order to live their life. And so it's a beautiful profession. We're looking at how children function in their daily occupations. And so it could be self-care tasks, it could be school, it could be making friends, social skills, interacting with friends, or finding hobbies. So it really is quite broad. And I think that sometimes makes it difficult for people to know what we do. But in working with children who have been through trauma, we're often called to help with self-regulation skills, because those skills often, if they're not there, or if a child hasn't fully developed their nervous system, they often get in the way of learning. And so that is one of the big reasons why occupational therapy is so helpful for kids with regulation concerns, whether or not they've had trauma, or whether or not they just have something going on in their nervous system that is preventing them from achieving their goals or independence in their activities. So that would probably be my way of defining what we do, looking at daily occupations.
Yeah, yeah. Big long description, and you summed that up really beautifully at the end, but it's a lot. And I think what I've learned over the years is there are a lot of different kinds, or occupational therapists. Like, I mean, you mentioned, right? There's people that can actually help you get back to work, but also there's ones who work with kids. And so if I'm an adoptive parent, and so I'm just thinking about the people that we work with,
Yes.
and someone says, I recommend an OT. What do you think that recommendation is? Why would someone recommend an OT? And and how could an OT help specifically in that, say, our AFCA population or kids who have experienced trauma? What do you think someone might be saying that for?
Oh, okay. So basically, what we're doing is we are working on those nervous, like basically, we're working on the nervous system in order for the child to be able to self-regulate. So we've all been dysregulated at one point in our life. In fact, a few minutes ago, I was because I couldn't get on the Zoom link. But I'm an adult. And so, I pull out my strategies, I'm chatting with a friend. You kind of walk me through it, what's going on. And I'm able to pull from those skills that I have developed over time since childhood. But for children who are in a constant state of hyperarousal, or they're missing those key skills for self-regulation, it's very hard for them to self-regulate. Actually, this might be a great time, Tanya, for us to pull up that
Sure.
learning pyramid.
Give me 2 seconds. I'll pull that up. Oop. Okay. So I'm sure everyone can see. So let's see. Learning pyramid was back here. There it is.
Slide
There you
2.
go. Can you see it yet?
I can see it. It's a little bit small, but maybe that's my screen. Hopefully
I think
people
it's
can
also
see it.
because it's the PDF and not the actual slideshow. I don't think
Oh,
I can make
okay.
it. I don't know if I
Yeah.
can. I'll see if I
Okay.
can. I don't think I can make it bigger.
And we can make this available to participants as well if you'd like a copy of this. So the learning pyramid, basically our central nervous system is the foundation for how we interact with people, how we interact with colleagues, how we interact at school, and how we learn, how we do everything in our daily life. So as an OT, we're looking at those daily occupations that we talked about. And so we need to have a healthy central nervous system in order for us to learn. That's what this slide is talking about here. So if you think about learning, that is a very higher level cortical function of the brain. Frontal
You mean
lobe,
like school learning?
school learning,
Yeah.
executive functioning. We need to be able, as a child in school, to be able to organize ourselves. We need to have time management and all those sorts of things in order for us to learn. And so if you think about it, if you think of this like a brick pyramid, I like to think of it, I always explain it to families like this is a brick pyramid, and we need to have stability or maturity in all of these different skills in order to be able to learn optimally. And
Right.
some
Because
kids
learning is
may,
at the top of that pyramid.
yes,
I'm
to the
seeing.
top of the pyramid. And so say we're putting a very heavy object, and you can visualize information from the teacher in a classroom. Say we're putting a very heavy object on that pyramid. Some children will learn and they don't have an issue with learning. But sometimes when we put a very heavy object on that pyramid, you might see bits and pieces of it maybe fall off or crumble. And so it's kind of a visual for thinking about a child holding themselves together, like being able to self-regulate and to be able to like come back and feel regulated to learn. Okay. And so in some of these children who've been through developmental trauma, some of these levels of the pyramid or bricks of the pyramid may only be partially developed. And so that creates an instability. And so if we start putting all of this learning information on top, or we expect a child to learn all of this stuff, sometimes it can be very overwhelming. And so if we don't have a strong central nervous system at the bottom, that the child has a hard time holding themselves together, being able to learn. They may learn some things, 100%, or they may have difficulties with learning because all of those foundations are not really fully developed. Does that make sense?
It does to me, and I love this because
Yeah.
I'm like a big polyvagal nervous system person. So that's
Yeah.
that's my favorite stuff.
Yeah.
And then I see, okay, actually it's great because I'm gonna actually skip the next question and stay on this slide because my next question was going to be what is sensory integration? And I see that on this pyramid.
Right. Yeah. So sensory integration or sensory processing is something that I'm pretty passionate about. So in order for us to know how to move or organize ourselves in our daily activities, we need to take in sensory information, and our brain processes that information. And when the brain processes that information, we're able to move correctly. We're able to make like a response to some sort of sensory input. And so, for example, I'll give a firm example. Say you have a child in a classroom and they have difficulty with, maybe they have an underdeveloped proprioceptive system. So proprioception, actually, let's rewind. So we have 8 sensory systems. Believe it or not, we have 8. And so we have the 5 senses that all children learn about in school, in kindergarten, but then we have 3 on top of that. So the proprioceptive sense is our body and space awareness sense. It's like knowing where we are in space, how hard to press on an object, and how close to stand to other people would be some really good examples of, difficulties with proprioception.
Yeah, I
And
always know I'm seeing a kid that's got proprioceptive problems when they're really clumsy and they bump into things a lot.
yes,
Or they're the kids who, when they hug their parents, they like knock them over. Or when they sit down next to you, they almost sit on top of you. They're kind of,
yes.
yeah,
So
they're kind
that
of,
is that's a wonderful example. So that's an example of a child who has difficulties, you know, processing proprioceptive input. So being able to take that information and process it and make sense of it. A lot of these children will stand too close to you, or like you said, they'll put a lot of pressure on their pencils. They'll break their pencils at school, or they might play too roughly.
Mhm.
And so they don't realize how hard they're like slamming a door, right? And so, if you think, oh, well, no big deal. But when you put a child like that in a classroom, if they don't have a good sense of where their body is in space, they often will have difficulty sitting in a chair. And that's not the
I've
only
often thought
reason.
too, like if I couldn't feel myself in space, how stressful that would be. Like
Yes,
how can I focus if my body can't feel where it's at too?
yes. So Tanya, I'm going to invite you to, you know what, this is a great opportunity for us to do a little experiment. So if you're at
Okay.
home and watching this and you're sitting at a table, I want you to pull your chair back, and I'm going to do it with you, and lift your feet off of the floor and see how stable you are, and try and write something. Okay. And then all of a sudden there's a loud noise. Okay, so the child is startled. They're in this state of hyperarousal. They're startled. They can't balance themselves well in the chair. Maybe they have deficits in tactile integration. Their pants are bothering them, and they've got like the tag in their jeans is bothering them, and they didn't want to wear jeans because a lot of these kids don't want to wear jeans. And there's a reason why kids have these difficulties, and we're going to talk about that further along in the talk. But so this is like an example of sensory processing difficulties, trying to filter in all that information and making sense of it and figuring out, okay, what is important right now? And then they'll fall off the chair because they don't have those skills. And then what happens with these poor kids is that, they'll fall off a chair and then they'll get in trouble for fooling around. And they really didn't need to, and they can't control themselves. So that's one example. But then you combine that with children who perhaps maybe don't get a lot of exercise and they've got weak core muscles. So they don't have a good sense of central stability and strength in their postural muscles. And so if a child also has those proprioceptive difficulties, then that's like 2 issues contributing to why the child doesn't sit up well in school. And so how are you supposed to pay attention when you feel like you're going to fall off of a chair and you can't make sense of that information? So if you think about the pyramid, we go back to executive functioning, it can create a lot of anxiety for these children. And so they're trying to learn and they're like so interested in something, but they have all of this stress inside because, oh, if I like move, I'm going to fall off the chair. And, it's so loud because Johnny is like clicking his pencil and I have auditory sensitivity. And like, can you imagine this? Right? So it's hard for kids to focus.
Yeah, so much more to pay attention
Yeah.
to. And I don't think that, I mean, most of the kids that I have seen, they're not aware that they're struggling.
No.
And over time, they just end up feeling like they're bad kids because they can't seem to sit still and focus like all the other kids can, and they get in trouble more. So then some of the behaviors too come from they're getting in trouble more often, so they perceive they are bad kids. So then
They
it's
are. Yeah.
just, yeah.
They're getting in trouble. And it's heartbreaking. So just most recently, I met with a 10-year-old boy, and he had been through a lot of trauma. And he said to me the first time I visited him, so we connected. Part of OT is like really working on, developing that relationship right from the get-go and not putting a lot of pressure on the child to do an assessment, So I always tell parents, the first session will look a lot like me just kind of hanging out with your child, watching them move, watching them respond to different sensory input. Anyway, this little guy said, I hear that you like hockey. Oh, you must be really good. Like, I hear that you're really good at hockey. Can you tell me about it? And he was so excited. And he said, oh, do you want to see my stretches? I said, I would love to see your stretches. And so he was showing his stretches to me. And so it was a way of us to connect together. And then I thought, okay, perfect opportunity for me to see how strong your core is. He's like, do you want to see my push-ups? I said, I absolutely want to see your push-ups. And so, that was a way for us to connect. So sometimes OT assessment can be very informal and sometimes it can be very formal. So that, we're gathering all of this information to learn about what the child's musculoskeletal system is doing, what their sensory system, how it's working, and if there are any deficits in sensory processing. We're looking at visual motor skills. So we're looking at all of these different skills through playful activities. And
So, oh, sorry.
That's
I
okay.
was just going to say, I've been in the room with you as
Yes.
a teenager and watched you do this. And within 5 or 10 minutes, you're asking the mom, did this person crawl when they were little? Because you've seen something. And you see these things that other people don't see, and they don't understand why that matters.
Yes.
And
So,
yeah, go ahead.
so basically the sensory motor systems are based on our early life experiences for movement. So this might be a good chance or a good time in our presentation to talk about reflexes. Can we do that?
Yeah, yeah. Do you want me to
So
go
you're
scroll
still, yeah, if you don't mind,
see if I
that would
can
be
find
great.
that? Yeah, I'm sure. There we
Okay,
go.
actually,
This
we'll
one?
just stop. We'll just pull it back there, Tanya, if you don't mind. Can we
One
pull
more?
it
Back
back a
one?
few,
There?
maybe a couple? Yeah, so let's talk about, this is perfect. So what sets
Okay.
the stage for our nervous system, which is the base level? So when speaking about children who have been through trauma, we all know that if a mom is in a healthy state and taking care of herself and exercising, not too stressed, and the baby is developing normally, then usually the baby responds and is discharged from the hospital and things go well. But sometimes there is a lot of stress. And so you can see this in a lot of adopted children and a lot of other children whose mom may have been very stressed during the pregnancy. And so having the mom being in a stressed state can actually, and this has been researched, and I don't have the articles here right now, but it influences the child's ability to regulate their nervous system. Also, the mother's movement, because like I just said, movement helps the sensory motor systems of the child to develop, even in utero. And so if you have a swim teacher who is expecting, they are constantly moving around teaching, and that baby inside is getting a lot of movement. And so the movement helps to develop the sensory motor systems. Now, in some moms, they have no choice but to go on bed rest, or they have to be very sedentary in their pregnancy for medical reasons. However, that sometimes can be a factor in how much movement that baby is getting. Okay.
I never heard that before. I learn something every time I talk to you.
The
It's
birthing process
interesting
too.
to me. Well, and I just want to, like, I'm an adoptee, and I want to bring up something because a lot of the parents we work with, especially when they've adopted a child really young or close to birth, they feel like, well, it should be that my child didn't really experience very much trauma. And I like to, I mean, I was adopted young. I'm old, so I was adopted way back when and things were different.
Yeah.
But I was adopted at 6 weeks, and they were not sure whether to adopt me out because even at 6 weeks, I was what they call a failure to thrive,
Mhm.
which I suspect has a lot to do with the trauma that I experienced from birth or from pre-birth, before birth. And I've met my birth mom and know a lot of the history and stuff like that. So
Yes.
this is really interesting information for me. And I think it speaks to, because a lot of parents can understand their children experiencing trauma if they've been through the foster system or all of those sorts of things. But even if a child goes directly to an adoptive family,
Mhm.
there's still trauma that is
So,
in that little child's body
and
often.
trauma is it's so subjective, isn't it? You know,
Yeah.
we can have some people that go through things and they show resilience. We have other people that go through different traumas and they may have like several difficulties, right? But when you think about the birthing process and the early, like the first few hours, right? If a child is born under emergency C-section, for example, the child does not get to move its way through the birth canal. And that is critical for the development of some of the primitive reflexes that we need in order to regulate or learn how to move. And we'll talk about that too. But, you know, if you visualize a child in an NICU, for example, their early sensory input is going to be quite different from that of a baby that just goes home with mom and nurses and sleeps and cuddles. They have doctors coming in, touching them all the time, different voices to process that information. They've got bright lights, a lot of beepers, like not a beeper, but
Yeah, beeps
alarms in the
and
background, like
buzzers.
IVs
Yeah.
going off. So
Mhm.
their sensory input, it kind of causes them to be in a bit of hyper arousal.
Mhm.
And so I find a lot of the children that I do see, and the ones that I've seen with you as well, they often have like a birth history, like a traumatic birth, or a birth where they really had to get that baby out of there and the baby was whipped out, obviously for medical reasons, but it does impact the nervous system.
Mhm. Mhm.
And I think there's a study out there actually saying that 80% of children who were born prematurely have some sort of sensory processing difficulties.
Mm. Fascinating. Yeah.
Mhm. And oh, let's talk about crawling. Can we talk about
Yeah.
crawling
Yeah, that's the one that
and tummy time?
yeah. Okay. Do I need to
So
scroll or we
those
good?
developmental milestones like
Mhm.
crawling and tummy time are so important. And a few years ago, and maybe the OTs that are watching this, they're probably like kind of chuckling as well. So OTs all over the world were very concerned a few years ago when the American Medical Association took out crawling as critical for developing as a developmental milestone. And so crawling is so important. Tummy time is so important. And that the reason why that is because it helps develop our proprioceptive system, which is our body and space awareness. And so we'll see a lot of children who crawled, that hardly ever crawled, or they just got up and ran. And usually the parents are excited that, you know, whoa, Johnny's running. He didn't even crawl, he skipped it. But as an OT, that really is a red flag for me because it talks about how that child experienced proprioceptive input as a child. So if you think about a baby on the carpet and the baby is putting pressure on their hands and their feet, they're weight shifting, right? They're up against gravity, they're developing their core muscles. and they're getting that deep pressure input through their joints. So not only is it strengthening their shoulder and postural muscles for further development, but it's actually activating those proprioceptors, which are like neuroreceptors in your muscles and joints that tell us where we are in space. And so it's quite complicated, right? And as a baby's they need to like get up on all four hands and knees, right? All four body parts, I was going to say. And they need to experience that. And so they're on the carpet and they're feeling the carpet and they're getting that sensory input and they're responding to it. So maybe they want to move quickly because it tickles, or maybe, they learn that, oh, there could be a blanket on the floor. So I'm making a transition to that. So that crawling period is very important. Also, believe it or not, crawling is very important for reading and writing skill development, because you're working on crossing midline. And so when we are asked to read a text, we need to visually scan from left to right. So there are often those challenges along with some of these proprioceptive difficulties.
And I think the thing that what I've learned is those are things that unless you know what you're looking at, you have no idea what you're seeing. And so I think for most parents, they wouldn't understand. I mean, I certainly didn't understand with most of the kids that come to my office, or my own kids actually, um, what sort of things I was seeing that were like these sorts of things I wouldn't be able to recognize. You kind of need to know what you're looking at to be able to define what the problem is in development, what building block is missing. And I'm guessing that kind of what you do is you kind of help put those building blocks back in place, or develop those building blocks.
Yes.
Yeah.
Yeah. So I'm mentored by Kimberly Barthel, and she is a world-renowned occupational therapist who is very well known in the world of trauma and sensory processing. And, she explains it as, I'm a behavioral detective, and I couldn't agree more. I always tell people, like, I'm getting out my little magnifying glass and I'm going to watch and see what's happening. I'm going to watch and see what's happening to the movement, the motor system, your eyes, the way that you perceive sensory information and respond to it, visual perception. I'm looking at that entire list on that. So it's quite complex. So no wonder people don't know what we do, right? It's a little bit complex. Yeah.
It is.
But
And it's subtle.
it's such a beautiful profession, because we're able to look at the child holistically, and then we're able to give them exercises and activities and educate their parents about how to help these kids regulate their nervous system.
Okay, I want to ask, because you have one more thing on here that really matters, and you've said a little bit about it, but attachment and co-regulation.
Yes.
Because most children who come to permanency through adoption or kinship, that early childhood trauma can really have an influence on attachment and co-regulation. So how do you support that? What do you do to help support that?
Well, I'm also trained in DDP, which is dyadic developmental psychotherapy. And in the province of Ontario, occupational therapists are one of the 5 healthcare professionals who can provide psychotherapy. And so I've learned from working with so many psychotherapists like you, how beautiful those two areas or professions can help each other out. And so, while I'm working on the body and helping the child regulate from a bottom up perspective, and working on all those skills, children seem to be able to self-regulate a bit better. And then we can talk about all of their concerns. But if there's like a disruption in the attachment, it's that child doesn't really feel safe going to that person. And so this is something I know you're passionate about, the polyvagal theory. So Tanya and I have worked together in developing different groups in the community, and Tanya has taught so many parents about how the polyvagal ladder works and how the polyvagal theory is so important in our work. and how parents can work on their own nervous system and recognize things about themselves that can really help their children.
Mhm.
So
You know
it
what?
is complex, right?
It makes me think of another thing, though, and that is sometimes, even though a parent is doing all the stuff right, a child struggles with attachment. And I
It's
think sometimes we don't get the message. We are actually, I think sometimes parents get the message that attachment problems are the grown-ups' fault.
oh,
And I think that this is actually a really good time to explain why that's not actually always true.
I love it. Because if they didn't have that early attachment experience, they're going to have difficulty attaching with adults, even their like spouses further on. Perhaps this could happen, right? It's like children have difficulty because they never had that model for them whenever they were very young. And if their nervous system was like in a state of hyper arousal, they're just trying to survive. And so those higher level attachment skills at the top of that pyramid it's difficult. It's
Yeah.
very difficult.
And I think about that if someone, because people's nervous systems are sometimes, or babies, infants, or children's nervous systems can be dysregulated also because of neurodiversity, prenatal exposure to drugs
Mhm.
or alcohol, prenatal exposure to mom's trauma,
Yes.
or also the NICU story. Children who go to the hospital and or are in the intensive care unit and have all of the things happening that are really stressful for them and don't get to settle down very much, don't get to experience safety. It's very hard for them to learn how to co-regulate because their nervous system develops heightened. Um, almost feel like it's like antenna looking for danger.
It
They're
is. They're
really,
constantly scanning the environment,
yeah.
And at school, like these kids can be sitting and they'll be scanning their environment because they feel unsafe there. And
Mhm.
so it's very hard to make friends or to feel comfortable with a teacher who is using a harsh tone of voice or, you know, really, and that all comes back to the mirror neurons, right? Which is
You know,
fascinating.
and the inner ears. Oh, Kim, sorry, okay, Heather. Why did I just call you Kim? You're talking about Kim Barthel, and I just whipped into Kim Barthel. Um, I'm just thinking about. I was reading a little bit more about polyvagal and the some people have heard of the safe and sound protocol. I don't think we need to go into it too much, but when you just mentioned like a teacher who speaks harshly, what I've really noticed is for kids whose systems are sensitive, so many of our parents, and I see this in my office too, kids who go, "You're yelling at me." And I've realized it's not that people are yelling at them, but that the smallest muscle in our body is in our inner ear. And when we're dysregulated, when we feel a sense of threat, we hear things differently. So a stern or serious tone is interpreted as yelling because our ears are actually hearing the world differently than when we feel safe.
Yes. Maybe just take the slides off there for a moment,
Sure.
Tanya.
Yeah.
Yeah, there we go. So it's so interesting. So the safe and sound protocol is something that I really love using in therapy as a tool to help children with regulation. So it's based on the polyvagal theory by Stephen Porges, who talks about physiological state and safety. And so in order for us to feel safe, we need to have kind of a happy balance in our nervous system. And so you're right, like the middle ear muscle contracts and it sends a message to our nervous system. It's all related to kind of vagal nerve activation. So there's a vagus nerve, and it's our longest nerve. It's our longest cranial nerve in our body. And it goes from our brain to our gut and back again. And most people are familiar with the vagus nerve. There's a lot of talk about that in
Mhm.
in magazines about how to activate your vagus nerve, how to tap into your nervous system to relax. And this is a way of tapping into that vagus nerve in order to have more physiological balance in that nervous system. And so it's a 5-hour music program that is used as a therapeutic modality with parents who are able to co-regulate with their children. And so they call it the safe and sound protocol. We need to have safety and connection with kids if we're going to be doing it. And so some parents are able to do it no problem. But if a family is in a state of extreme stress and they're not able to sit and maybe play with their child, or they're just feeling their own nervous system feeling dysregulated, usually it's done by a professional. And the music this is so fascinating, but it activates the vagus nerve by causing a vibration in that middle ear muscle. And so the music goes at different frequencies and hits that middle ear muscle, triggering a vagus nerve response, and it helps to settle the nervous system down. And the best results have been in my work with children who are autistic. I do find that this protocol is helpful for kids who have been through developmental trauma, but it needs to be done very, very slowly for a lot of these children.
I learned that.
Yeah.
Yeah. It's yeah. I just think this stuff is it's to me, all of this is useful because traditionally years ago we just wanted to send kids to therapy. And I remember learning, actually I got to learn from Kim Barthel quite a bit too, and really learning, and Bruce Perry, that we have to go from the bottom of the brain up, and you mentioned that earlier, bottom of the brain up. If we and talk therapy works from the top of the brain down. And so there's a little bit you might be able to do, but for so many of our kids, I think this is why I love occupational therapy. Occupational therapy is so much bottom of the brain up to regulate, and then you can maybe do some psychotherapy and some talk therapy. But until you can get that sensory system and some co-regulation happening with play, body movement, all sorts of things, you can't really have a conversation and do any learning. And that's really what you were saying from the beginning. That pyramid, really, psychotherapy is working from the top of the pyramid down.
Yes. And it's great if you're there and able to do it, right? But so many of these kids aren't.
Yeah.
But the children we've worked with, they have a hard time talking about their feelings or organizing themselves to even understand what you're saying. And so that's why we really need to work on the nervous system.
Or it can just take so long. Like, I've worked with children for years, playing hide and seek and doing all sorts of things before we ever had an actual therapeutic conversation. Just
Yes.
because it took that long for the child to actually to trust
And
me.
you know what, Tanya, you were already working. If you're playing hide and go seek, you're working on some of those sensory processing skills, right? You're like getting the child to hide. You're giving them a small area to like a fort or something where they feel safe, right? You're making that area safe for them. And so that if they have difficulties with proprioception, you're helping them to organize their own sensory system. And so that's why so many of these kids, they love to hide in things or get behind the couch or make forts, or it's the reason why some of them love to have the lights dimmed. It's because it blocks out that excess visual sensory input. So
It's why
doing that.
teenagers like to wear hoodies.
100%. And hoodies provide that tactile input all the way around the head, and they kind of block out some of the visual
And the hearing. They just, yeah.
A lot of those kids that wear hoodies or love those ball caps constantly, they want to take it off. It makes them feel secure, right? And so that's why they do it. But there's an underlying sensory reason for that.
So that just makes me, I'm going to go back to a question or two. So one of the questions that we have here is so a lot of the parents, when I'm talking to parents about OT, they say, oh, my child has OT at school. And so I think it's kind of important to maybe talk about different jobs OTs do and what's the difference maybe between going to private OT and an OT at what you might get at school.
Yes. So all OTs, now it's a master's degree. I've kind of been grandmothered in because I've been practicing for over 25 years. So it was changed a little bit. So we all have the basic courses in anatomy and physiology and neuroscience. And, you know, we all receive that education. So we have a baseline, right? And then after we graduate, depending on our area of interest, you know, we go and we like train in different modalities or we learn different techniques. And so it's really, I feel like I'm learning something every day, Tanya. It's like there's always something to learn or courses to take. But the difference overall between a school OT and a clinic OT, or someone who is trained in, you know, helping with self-regulation or nervous system regulation, is that typically those people have spent a little bit more time taking courses. And also, I really feel for the school OTs because I once worked in a school. And so they're given a very heavy caseload where most of the work is consultative in nature. And so they're trying to help teachers and educate them on what a child needs. And so it isn't very intensive. You know, they might come in and they will give suggestions. And so there's that bit of a difference as well. And they don't
It's
have
kind
the
of
time.
more, it sounds like it's more about helping a child get through the day at school than actually being therapeutic for the child to actually kind of help them develop some of those blocks.
Yes.
Yeah, okay.
Yes. They're also working on the nervous system, but in a different way, perhaps. They just don't get the time to spend a lot of time with children. And so, you know, they're assessing and they're providing recommendations, but they don't get like an hour session with a child to work on all of those parts of the pyramid.
Right.
So that's a very challenging position to be in. It's
So
more of a support role.
in private practice or in a clinic, say, are all OTs alike? Or like if I were looking for an OT for my child, what would I want to look for? What would I want to ask?
You would want to ask if they are trauma informed, because that's really important, right? To understand how trauma impacts the nervous system. You'd want to ask if they were trauma informed, if they have a background and understand sensory integration, whether or not they've done any work like that, or whether they've experienced working with children who have been through trauma, you know, because that really impacts them. You know, I actually have the privilege of mentoring all of the OTs at our clinic. And so we get together and we share ideas. And like I said, I learn something from them every session as well, just different things that come up, right? So it really, if they have a background in sensory integration, that can be very helpful. Also, some of us are trained in primitive reflex integration, which is was developed by a educational kinesiologist. And so some of us have that background. And so we can assess a child's primitive reflexes and their movement patterns and figure out, okay, does that child have a retained primitive reflex? You know, is there a reason why that child doesn't like the tags on their jeans and why they're really bothered by that? So, and then we can provide some exercises for the family to take home and work on those sorts of things together.
Okay,
So
so this primitive reflex, I know you talked a little bit about that, but I feel like that's something that probably most people haven't heard enough about.
yes,
So I feel like there's probably when you say primitive, I mean, I've seen you do some of this stuff, so I have a bit of an in, but I want you to kind of explain a little more what that would look like, what you would see, and what you might suggest, and even what are those primitive reflexes? Because we don't
yes,
know about them.
sure. So primitive reflexes are reflexes that babies are born with, and they're protective in nature. So if you remember, you know, holding your baby and then say you move quickly, the baby's arms would come out, right? And so that's a protective response that babies, you know, they don't have control over that at birth. But as a baby moves around and experiences like the sensory world, what happens is that, you know, those movement patterns help mature the brain. And so they help with integration of those primitive reflexes. It's not like we don't lose those reflexes. They're just stored in the brain for times when we are under a lot of stress or there's been a trauma in our life. And so children who have been through trauma, they often, for example, like they maybe didn't experience some of those early movements to help integrate those reflexes. And so we had talked about like children with being in a heightened state of arousal, right? A lot of those children have a retained moral reflex. They'll startle at simple sounds, they will be highly anxious and they'll hold a lot of tension in their shoulders. And so they'll often cross their body, and some are very protective of their body. I had a child the other day who kind of came in to see me. I could tell that he had a retained moral reflex because he was holding himself like this. And so I look a lot at the nonverbals, right? What's happening in the postural system. And so this little boy, I said, do you want to jump on the trampoline? And he was jumping on the trampoline with holding on to his body like this in a protective way, right? And so those kids are holding a lot of muscle tension and they're just highly anxious. So they'll startle a lot to sensory input. They don't, if you like came up and touched them, they would jump, and even adults have some primitive reflexes. So it's interesting. People who have gone to war and they hear like bombs going off, and I think of the Ukraine, all those children who were in Ukraine or perhaps now even in Gaza, they are always exposed to, like, they're probably looking, like you said, they're like scanning the area for information to make sure that they're safe, right? And so those soldiers that go to war, they come back often with PTSD and they have a lot of muscle tension and headaches. And what happens is that some of those primitive reflexes that were stored in the nervous system before, they're activated when a person comes back from war. They often come back after a person's been in a car accident, and these are all protective mechanisms for the brain and the body. But when they come back, they can contribute to a lot of like sensory difficulties. So to remedy that.
Yeah. Yeah. Thanks. Keep
Yeah. So to remedy that, if we go back in developmental time and help children move through those movements that help to integrate those reflexes, we can have more balance in our nervous system. And
So what would
so
that look like?
it may
Like
be
what sort of
things.
things?
Yeah.
You go.
Well, for example, there is something called the spinal galant reflex. And so that reflex is present in the spine. And so if a child is having difficulties with tolerating clothes, for example, a mom may come to me and say, you know what, Heather, they don't wear jeans. They are always like pulling on their shirt from behind. They don't like when people like approach them. That tells me a lot about what could be going on at the reflex stage. And so I will test their reflexes. And sometimes if I know that the response is not going to be well received, I will assume that that reflex is actually positive from what's going on. And so if I see a child who's moving around in their chair like this and they have a hard time sitting still, chances are that they're going to have that reflex. And so I will engage them in fun activities and games that will move them in a way that will integrate those reflexes. So for example, we do snow angels. So we can do a lot of snow angels, which is perfect for today in Ottawa because we have all of this snow. And so I'll get them to do snow angels inside and then go outside, right? And so that is like a fun activity that is actually working on integration of those reflexes. So activities like that are specifically aimed at moving in a certain way to mature that sensory motor system.
Okay. And that's why I remember seeing that with someone who hadn't crawled. You kind of gave them exercises to do that imitated crawling.
Yes.
To kind of get get them, I guess, to restructure that level, that system. I don't know. I guess that's not really a reflex system. That's not, is that? No, that's not reflex. That's the other integrating sensory and
it really is quite complex. So if I get someone to crawl, if you think about crawling, you're strengthening that postural system.
Okay.
You're working on proprioception, you're working on improving core stability, and you're working on reflex integration. So OTs are providing these specific exercises. If they're trained in reflex integration, they have a better understanding of what sorts of things you need to do and how to incorporate that into play. So even older kids, the parents will say, really, you want me to get them to crawl? I'm like, yes, I know it sounds ridiculous, but we can make things fun for kids, right? So if I have a child who is obsessed with Pokemon, for example, and they're 12, right? I will make an obstacle course in therapy and have them crawl over a mountain to get a Pokemon card. And the Pokemon card will say, do 12 jumping jacks to a beat, right? So we know that rhythm and movement helps with nervous system regulation. So it's all about providing that specific sensory input to help with self-regulation.
Oh, I have a one question, because some of our families are, well, hey, we have someone here from New Zealand, but some of our families are from all over Ontario, at least the ones that we work with in Interwoven. So what happens if they can't find an OT in their area? Can OTs do virtual sessions? How could that work? Because that must be complicated.
Well, yes. So I have a couple of families in different parts of Northern Ontario right now. And so while it isn't ideal, I can't really, look at their muscles, and I can't feel with my hands. So I'm a very tactile person, very hands-on. I can't like test their muscles specifically to have a sense of the tone that they have. But, at least meeting virtually can really help pull together an understanding of what's going on. So I have assessed children virtually, and I can get the mom to set up a camera and, ask them to do some jumping jacks, or ask them to like stand in one leg, and I look at their functional balance. And by watching them on camera, I'm able to assess to see, okay, I think this could be active. And so I'll say, okay, mom, you take a pen. I want you to get them on hands and knees, and I want you to stroke the sides of his spine, and what happens? And so if they say like there's a flinch, then I'll say, okay, well, looks like this child has a spinal gland reflex, right? Or if the child startles suddenly by, say, the dryer timer goes off while we're in session, that tells me a lot about what's going on in the nervous system. So I try and really make it playful. And for the most part, kids really enjoy it, because it's like, oh, my mom's doing these cool things with me, or dad, right? And so it's a way of assessing how they're moving. And then I give them exercises to do at home based on that information. It's a lot of parent coaching, and sometimes the parent information sessions that we have, they can be very helpful, because I never want to talk about a child in front of them, what they're struggling with. And so it gives me a really good chance to explain my clinical thinking about what's going on in the body. So
Okay. So,
yeah,
so you're saying, and I would do that too. Sometimes you want to speak with parents without the child there, because there's a lot of, because parents have so much influence, and
yeah,
they live with them. There's only so much we can do in an hour session, but
exactly.
parents can start incorporating. And I'm guessing you probably have come up, I mean, because I bet you've got some really cool things that you've been able to help people incorporate in their homes.
Yes. And so some of these things can be done very inexpensively. So one of my favorite activities for working on body awareness or proprioception is to get a child to jump on like a mini trampoline inside. And so to set up some of those Yogi Boo cushions, or an old duvet cover filled with old cushions, and get the child to run and jump into it, or jump and crash onto it. And so that was something that was an activity I learned about during my sensory integration intensive in the US. And so, you know what, one thing to mention is that there needs to be a change within Canada. Many other countries, the OTs are trained in sensory integration. And, it doesn't seem to be in Canada, we don't seem to have such a emphasis on that when we're in school. And so, but because these children are, been through so much, we need to understand that. We need to understand the nervous system.
I
And
can
so,
honestly say learning the sensory piece had a massive impact on the work that I was able to do supporting families, and in my office as a psychotherapist. Like I integrated sensory stuff all the time.
Yes. And I
Like,
hear that over and over again from
yeah.
people that I've worked with. And it's beautiful for us as an OT because we actually see the child's nervous system relax.
Mhm.
And then they talk to you and they tell you all of this stuff, right? I had a little
And
boy break down the other day and say, you know what? Nobody understands me. He's like, nobody understands me. I got in trouble at school and I had to earn a fidget. And so, behavioral charts don't work with these kids. They can never, they can never achieve those things. So a behavior approach to these kids can often be very damaging for their psyche. You know, the child reported that, he loved one of his teachers. She was so nice. And I said, oh, what makes her really nice? Well, she's just very nice. And so I figured out that he was talking about a very soft-spoken teacher who probably understood the importance of like nonverbal communication. And so and that goes back to the mirror neurons too, right? If we like, all right, sit up and listen, and you're like expressing yourself and you're mad at the child, their nervous system is going to be even further dysregulated, as opposed to someone who speaks calmly.
Mhm.
So there's a lot of education to be done, and I think we're going to get there, but it's slow. And so a lot of people think, oh, we're going to implement these behavior charts. And then the poor child will never get there. And then they feel like they're a failure, and it can cause a lot of depression for kids.
Well, it makes me think of that child who has a hard time sitting still or holding themselves up in a chair. And the teacher, says, if you'll earn a star if you can sit still. Well, that is it's basically rewarding, children fidget sometimes to keep themselves okay.
That's
So
right.
taking that
Yeah,
away from them is like punishing their disability.
it is. And
Yeah.
also it's just they can't control it, right? And so that's heartbreaking to see like a child who feels so anxious. I once had this child say to me, I feel like I'm just so stressed at school. This was a kid who was able to verbalize a lot after we had worked on the regulation. He's like, it's like someone's poking my skin. Someone pokes and something bothers me and it pokes. And he's like, I don't like the way it pokes and I feel like I'm going to explode. I said, oh, you
Mm.
mean like a volcano? Sometimes like the lava comes out because you're just so upset. I said, I'm so sorry, right? I'm so sorry that happened to you. So there's a lot of education to be done around trauma.
One of my favorite things is too, though, is I love when I get to talk with a family and we start talking about sensory stuff and you see parents who've attuned and they've gotten it. They figured it out. They don't know what they figured out. They couldn't name it. But I
Yes,
remember when I used to talk to parents about sensory stuff and they'd say, "Oh yeah, we buy all our clothes at Value Village because my child doesn't like new clothes. They don't feel good."
yes,
Or, they don't wear jeans, they only wear leggings, or they wear clothes really snug, or they wear
yes,
clothes really loose, or, and parents have often figured out and already adapted to some of the sensory needs because they're attuned and they're loving.
yes,
And they just don't realize they're doing it already. They're doing the job already. And it's
yes,
sometimes really great when they get to talk to someone who gets this stuff because it affirms to them that they've already been the behavioral detective on their own
yes, they
without
have
even knowing
been.
they
They
have been. Yeah.
absolutely right.
Yeah.
Can we talk a little bit about some other fun things that they could do at home?
Yeah, please do.
Maybe bring up the slides again. I'll show you
Oh,
what the clinic looks
give me
like
2 seconds.
inside and some of the
Okay,
things that
where
we
is it?
can do
There it is.
fairly inexpensively. I hope that this has been helpful information for families out there.
Okay,
It
give me.
is complex.
Yeah. But actually, there's a lot of things that you're answering that I think most people don't know because like you said, it is there's your different. Oh, there's it's asymmetrical tonic neck reflex, and there's a reflex that affects. Oh,
And
there's
so
all
some
sorts
of,
of. So we're gonna send these slides or this to everyone. Okay, so
sure.
you're gonna get to hear. You're gonna get these.
Yeah.
Oh, here we go. There's your clinic
Oh,
stuff.
yes. Yes. So the picture on the left is actually me at OCAT working on the Achilles tendon, so releasing some of the like the muscle tension within that muscle belly through deep pressure. And so this child came to see her psychotherapist at OCAT, and she came and saw me, and I really noticed that she was doing a lot of toe walking. And so she had very, very tight Achilles tendons and muscles, and she just had so much tension in her body. And she would love to throw herself into those crash pads. So there's a bean bag in the back there. She used to run and jump on that. And so her proprioceptive system really was underdeveloped. And so I was giving her some of this sensory information through some muscle release work, right? But in order to do that, she has to trust me, right? We have to develop that relationship so that she can tolerate me touching her skin, and she can tolerate the lotion. And so she said to her psychotherapist, "Can you massage my legs?" And I wasn't there, but this child needed that input in order to feel relaxed at the nervous system level and to be able to communicate what was going on in her body.
Yeah.
The second picture is of a therapist and a child at our clinic, and that is Lycra, which is kind of like that stretchy bathing suit material that you can buy at Fabricland. And so I'll often get families to go and get I don't know, 5 meters of that and stretch it, like pretend that you're like gonna get in there and you can do snow angels and press out against it, because what that's doing is it's helping organize the nervous system by giving some of that deep pressure over the body. So those are ghost suits.
Or body socks. They have, aren't those body socks as well? They have
Body socks. There's
yeah,
various
yeah,
names for them
yeah.
depending on where you're
I
from.
think you can even get them on Amazon, and I think they're called body socks on Amazon. They even have
Yes.
them, yeah, yeah.
And
I've
so, you know,
can
it's
see
also
through
getting,
that.
what is it?
I was gonna say, I was saying you can see through it. It looks, when you're
Yeah.
watching from the outside, it looks like your child can't see. But I've been in one and you can see through it perfectly clearly, but you get so much pressure on your body, and kids really like it.
Yes. Now, on the flip side, we have children who are very guarded and they don't like movement. They have a sensitive vestibular system. And so they don't like movement. And so this is a fun way to get some movement once a child is regulated. So the deep pressure is regulating for most kids. Most kids it is, not all the time, which is interesting. We need to figure out their sensory profile, right? And then we can, you know, get a piece of that and we can say, okay, we're going to spin round and round. Let's see. And so some kids will need that proprioceptive input in order to be able to do that. If they didn't have that on, maybe they wouldn't be able to do that. So it's providing a sense of safety and comfort as well, right?
Yeah.
You really look at it closely. And then there's the famous peanut ball, which is probably what I would take if I were to go overseas somewhere on a missions trip. I would take that peanut ball. And the reason why I love peanut balls is because they're a bit more stable than an exercise ball. And so kids often need something a little bit more stable. You can sit on it and ride it like a horse. I've had many rodeos in the therapy sessions, right? So, okay, we're gonna like make your horse go really fast. And so kids have to like respond and, you know, follow the directions. And they're learning about, you know, how hard do I have to press my feet into the ground to make that move? You can sit on them for homework. You can sit on them for watching television. And while you're sitting on it, you're also working on your core muscle strength, which is required for learning and attention. And so one of the fun things that we get to do is we get to develop, my work also involves some home visits. So I get to help families design a sensory space, which was going to work and provide the appropriate sensory input for their child. So this is a picture of a little boy in a sensory space. This one was taken at the clinic, but we set it up for him at home, if I remember correctly. So older picture. And then, oh, this is a picture of me years ago at our clinic with a little girl. And she needed a lot of movement to regulate, but she also needed to develop her body awareness. And so she is on a scooter board and she's going down a ramp. And mom's on the other side here taking the picture, and she's crashing into those blocks. And so she's learning, how fast do I need to go in order to knock them all down, right? So just a fun activity that we use in the clinic. I realize we're probably soon running out of time, Catherine.
Yeah, we're at 8:15. So do you want to show a
Yeah,
couple more of these pictures?
sure.
A couple that I've
So
seen.
let's
Oh,
talk
this is
about
good.
full body vibration. Can we do that?
Yeah.
That is a vibration plate
Thank you.
that is used to increase core muscle strength and provides that proprioceptive input to the nervous system. Some children love it, others don't. So this is an example of an exercise that I've given a teenager who was adopted and had difficulties with self-regulation, who was very anxious. And so I'm working on several skills in this activity, working on her postural system, her pelvic floor, because when you don't have a strong core, you can't breathe in order to self-regulate. So when you think about that, inner core strength is really important for self-regulation because of the way the core works and how the diaphragm moves. And so I do a lot of breath control activities and pelvic floor,
That's
core
one of my favorite
muscles.
ones. Sorry, I'm pointing at my
Yeah.
computer screen. This one I've seen Heather do.
Yeah, so this is really fun. So getting a child to inhale and then blow out can be very hard. And so this makes it a fun activity. And I've used this activity in home visits, and I've taken a kid from a state of hyperarousal and I said, oh, let's do this. And I remember not this person in the picture, but I remember like it took like 5 blows out and all of a sudden the kid was so calmed. But it was because that we actually were working on breath control, which is for self-regulation, right? We're in yoga, we breathe in, we blow out. It helps down-regulate the nervous system. And then visually, if kids really seek visual input for relaxation, they're looking at the bubbles. Some of them will touch the bubbles, and that's very calming for them.
Well, and I know for me, I don't think I've ever had a child come into my office and like so many people have tried to say, take a deep breath when they've been stressed out or breathe. And kids
Yeah.
are like really early on, they feel really triggered by being told to breathe. But
Yes.
if you just sit and you don't tell them they're even having a breathing, you don't tell them you're doing a breathing exercise. You just blow bubbles in a bowl and see who can blow the most bubbles and the hardest. They're breathing and they're exhaling, and that's so regulating and it's fun. And they're learning how to coordinate breath and
They're also working on their ocular motor skills for reading, As you're blowing, our eyes have to focus. So there's so many skills from one simple activity. So OTs are known for activity analysis and breaking down all of those activities.
I'm gonna just like scroll because you see a few other
Yeah.
there's your little massager. I don't know what this one is.
So that is a
This
metronome in
is
the back.
yes. Okay,
Yeah.
that's what's going
I
on.
love to use music, and so I will use an old style metronome, and you can use it on your phone. And it
Yeah.
really, like, we play movement games or pass the ball to the beat, right? And it helps kids to regulate their nervous system and to learn, just to slow down or speed up.
Okay. I'm gonna stop sharing because I
Yeah.
don't know if we have many questions yet, but I also
Okay.
I
bet
have
that
many questions.
I was gonna
though.
say I bet you Catherine does.
This
I
is
know
my
Catherine.
turn. I need to apologize.
No. Okay, well, I think what she's going to apologize for is the fact that her internet's not very good, and she might just pop off again and pop back on because she just froze. Which
Yeah.
is too bad because Catherine always does have really good questions. But I'm gonna actually, oh,
There
she's
she
back.
I'm
is.
There we
sorry.
go.
My
Chewing
internet
gum.
is terrible. I do have questions. My first one, yeah, chewing gum. Someone told me that chewing gum is good, and my kids who are older, can you talk about what that is and why
I'm
and what it
I'm
helps?
going to interrupt it first, and I'm going to let Heather take over. When any kid comes, I have at least 5 different kinds of chewing gum in my office at all times. Every kid that comes in is offered, and they're all like the wacky flavors, and because that is like the easiest in, A, for me to look cool and fun, and B, for regulating kids when they first come to see me. But I'm going to let Heather explain why that is.
So that's interesting. So all of those kids that you've seen are okay with things in their mouth. And so a lot of kids have sensitivity to oral tactile information, which is why some kids are such picky eaters or they'll gag. So that's interesting to me. But yes, there are many ways that chewing gum can help with regulation. And so I buy extra packs when our university sons are writing exams, for example, so that they can help, it can help with focus. And, you know, we all have different needs. And some people get a lot of, it's movement of their jaw muscles, right?
Yeah, to me,
And
it's the
it's also,
proprioception, it's
it is,
rhythm, it's flavor, it's
it
smell. You
is,
got like you're hitting it all at
it
once.
is. It's
Yeah.
wonderful.
And it's
And
something
so
you're not supposed to do in school. So like that's like a whole other thing.
yes. And it can be very helpful and regulating for kids to do that. It's almost like a fidget. It's a fidget in your mouth, really, right? And for some kids, they would never choose that, you know, because sometimes I offer gum to kids and they're like, no, I don't like that. I don't want to put it in my mouth, right? And so it really depends on their sensory profile, but it can be very, very regulating, you know,
And if kids like
just like how
lots of
people,
gum, like
what's
some of
that?
them like 3 or 4 pieces of gum, like they like a big
Yes.
block of gum. Yeah.
And the reason why they need that is because they need extra proprioceptive input or they like the way it feels in their mouth. And so kids who are seeking proprioceptive input, they'll often overstuff their mouth. They'll shove a whole cookie in there. Or they
Awesome.
might, you know, not realize and they have a full mouth and they're trying to swallow, you know, they have the chipmunk look because they're storing food in their cheeks, right? But that's a really big clue sensory wise that there could be something going on.
Yeah, and someone commented that they actually have it in their kiddo's IEP, so that their child can chew gum at school,
It's
which is,
amazing.
and some teachers frown upon it. Yeah,
Oh yeah.
banned in our
Some just won't
school.
let you. Yeah.
Yeah.
But thankfully we have good teachers who are sensory friendly, and I'm like, well, you can choose the chewing gum or a meltdown. So
And I think that this is becoming more like commonplace to have like alternative seating or a little calm corner, which is
Yeah.
amazing, right?
Yeah.
Those
The
teachers
seat.
really understand that kids need to move.
There's
the
some
good like
really cool
wobble
seats.
chairs or whatever, right?
Yeah.
Whatever they're called.
Yes.
Yeah, my kids have them
Yeah.
too. They're amazing.
Yeah. And
We
that's the
we have
thing,
two
right?
questions. Sorry, please go.
Not everything is going to work for every child.
Mhm.
You know, some kids hate those wobble chairs and it creates more anxiety, right? Because the vestibular system is kind of not developed. So some things will work and other things may not work. So that's why it's important to kind of really understand what's going on from at a sensory level, right?
Mhm. Mhm.
Yeah.
Yes, I'm so sorry. We do have two questions. I think you kind of answered one, but I'm gonna,
Okay.
we got more questions coming in. I'm gonna read them and we can hopefully answer to the best of our ability, us as in not me. So the first question is, do you, and I'm gonna put this to both of you, do either of you work with family overseas? You did speak about that already. But this is more towards AFCA and FASD or trauma. So, and how OT can play into that. So I'm wondering if there's resources for families who might be outside. I know, Tanya, you know this. It's tough, but we're trying to get there.
Yes.
We're just wondering about families who may need sensory needs for it's outside of Ontario.
Yes. So Ontario can be a little, it's a little bit tricky when you're practicing in Canada as an OT. And so you know, I'm registered in the province of Ontario, as would Tanya be. And I'm not sure what it is with your college, Tanya, but we're not really allowed to see anyone out of country unless we're registered in that country. We are, you know, allowed to provide education and talks like this internationally, that's fine. But when it comes to actual treatment, we're not able to do that. And that's to protect the family, right? And to protect our profession and to provide like high quality treatment. I think the furthest away that I've had someone was in the province of Alberta, and that was because in the pandemic, a family could not find an OT who had a training in sensory integration. And so they contacted me and I was able to reach out to Alberta and get a temporary license. Now, since that time, OTs are now able to practice in multiple provinces within Canada, which is great. Not all. Quebec is a little bit tricky. But you know, I've had people in Nova Scotia, Alberta, BC, so from all over the place.
And I know that the AFCCA team here is working really hard to make as many resources and supports as accessible as possible, while knowing that there are still restraints and constraints at this point. But the
Yes.
hope is eventually to make this worldwide and to train as many professionals worldwide. So I guess my little answer to that is that if you are working with a professional might be out of Canada, might be out of the country, still connect them with the AFCCA team, because they provide professional training all over the world, and a lot of them are free and anyone can join them. So I don't know if you can add any more, Tanya, but I know you guys are working so
all I
hard.
would add is just if anyone wants to fly me to New Zealand, I would be so happy to do an in-person training.
Where it's hot and sunny.
I'll come with you.
Man, I don't care what the
host.
weather's
I'll
like. I would
host.
just love to go.
Yeah.
Sorry.
But I'm a part of a global mentorship alliance. And so that is through Kim Barthel. And so I'm mentored on a monthly basis by Kim, and I'm well connected with international occupational therapists. And so that might be another route if someone's looking for an OT in New Zealand. I probably have met someone from New Zealand online or via social media. And so I love OTs. Like we're a friendly bunch. And
You're
so we love
everywhere.
to talk shop, and we love learning from each other. And so I've made a lot of connections just by going to courses over the years, and yeah, through that mentorship. So
Perfect. So if anyone is watching this on replay or live right now and you are looking for a connection, you can always email us at info@interwovenconnections.ca, and we'll get you connected. If we don't know the answer, we know Heather's contact, so we'll
Sounds
get you hooked up.
I can find her.
Exactly. So very quickly, I do want to respect everyone's time. We do have 2 questions I'm hoping we can sort of answer to the best of your ability. Any thoughts on soothers or soother use beyond specific ages? So soothers, wow, let me try that again. Any thoughts on soother uses beyond ages? No. My brain.
Beyond
Go
ages
ahead.
soothers are made for. Yeah, beyond the soother users, beyond ages soothers are made for. It's
There
different
you go. That's a tongue
chewing.
twister.
Yeah, then we've tried everything. So
for sure. So soothers well, that's very calming, right? That's why babies just latch on to their mother's breasts immediately whenever they're born. Typically they do. And it's nutritive, but it's also a soothing thing. And so some kids require a little bit more oral sensory input in order to regulate, or that's their way of seeking that sensory information. So I get this question a lot. Those kids often will still want to suck on a soother, but we do know that it can impact dentition. So you can develop an overbite from being on a soother for too long. And so in that sort of situation, I would try and give some extra oral input to that child so that they're receiving that same input, but in a different way. So for example, the bubbles might be good for an older child, or, playing a little game where you make faces in the mirror, or you're sucking on a sucker, right? So it's a different form of oral input in order to get that kid to regulate. So, it's quite complicated. There are a lot of different techniques out there, using like a little vibrating pen that we use in therapy. And so that person would probably benefit from going to see an occupational therapist who has a background in sensory and understands oral sensory input.
That's really helpful. Thank you. And the final question is, it's going to be hard to answer in a minute, but we're going to ask it. Do you ever see kiddos who swat or hit out of nowhere without an apparent trigger? So maybe that's a sign, I'm sorry, folks, maybe that's a sensory input seeking behavior being read as aggression. So do you have any thoughts or inputs?
Oh my goodness, yes. So that child may have difficulties with proprioception, knowing where they are in space. And so by hitting something, they're getting a point of reference. They're getting that input and it helps them. Maybe it's not related to that. It could be related to like an impulsivity thing or a tick, right? It could be a tick that people will hit. And so you know, that's the body releasing tension because they haven't been able to self-regulate. So absolutely, very much related to regulation, or could be.
And I
Yeah.
wonder about like what sort of things, like even things, are there games or exercises or things that you be doing where there's like that kind of, I mean, I'm thinking push-ups, but not, you're not going to be able to say, hey, drop and do 10. That's not going to, kids aren't going to do that.
Yes.
But
Yeah.
how can you make games where kids are getting that input so they're feeling it?
Oh, the
And that,
possibilities are endless.
yeah.
So Twister is a really fun game, right? We're putting pressure through our hands and our legs.
I know I've seen parents who put climbing walls in their houses.
Absolutely. That's so
Yeah.
fun, right?
Yeah.
So you're working on strengthening, but you're also getting that sensory input. I have a lot of kids that like to go to the park and hang from a structure, and it's putting traction through those muscles, right? Providing that input.
My daughter
Twister
has
is
very
what-
special complex needs and has a very aggressive outbursts. And we actually did something called a sensory diet where an OT came and just rocked our world. And it actually gave us like what to eliminate and what to give, and not diet as in food, although that was part of it. It was like her whole environment, and that completely made a huge, like it made a complete impact on her regular. It's not perfect, but it made a big difference
Yes.
for us.
And you know what the key is? The key is to provide that input before a child gets dysregulated. That would be an example at school as well. So, you know, we don't wait until a child is feeling dysregulated and visually stressed. We need to provide the body with that input to prevent or be a prophylaxis to the meltdowns, right? And so that's something that I think the world needs to hear, is that these sensory diets, they help the child regulate at the nervous system level so that they can engage, right? We don't wait until they're dysregulated and then try and get them out of the room. I once
Well, and
had,
once a kid's dysregulated, they're not interested in cooperating. Like once someone's dysregulated and you say, hey, try this, they're going to go,
yes.
no, because they're dysregulated. They're
Now,
not going
what
to
to
be,
happen if they are dysregulated? I'm going to tell a little story if it's okay.
yeah.
I had a boy come into my session and he said, Heather, you talk too much. He's like, I don't want to talk here. I don't want to be here. I don't want to be here. But I knew that he loved the swing. So he went on this platform swing, and I slowly placed myself in a chair and I reclined, and I like eased my body, even though I was a bit worried myself and internally stressed, like, oh, is this guy? He said, if you say one more word, I'm going to destroy your office. So I leaned back and I'm like, so what was I doing at that? I was giving nonverbals and trying to get his mirror neurons to start firing and replicate my nervous system. And so that's really important, self-regulation. Anyway, and then he went on the swing for about 5 minutes, and he figured out he can get something out of my drawer in my office. And so he gets at this button that you hit and it goes, that was easy. It's from Staples years ago. And so he looks at me and he smiles and he starts giggling and I start giggling. And then all of a sudden he just broke down and he said, I'm so sorry, Heather. I'm so sorry. I was so stressed out. The group home workers, like, they made me go in the van and they just said, we got to go now. And so he was so stressed out by the time he got to therapy that he just lost it. And he was going to destroy my office. So sometimes we can use sensory input in the moment. We can use these interventions, but it's way better if we give that kid the sensory interventions before they actually lose it, right?
Yeah.
So
Well,
I love that story because it talks about attunement. It talks about mirror neurons. It talks about how that child, I made him feel safe in my office. So we did a craft
yeah.
and he
To
loved
me,
it.
it's the difference between like a sensory diet kind of keeps things more even and stops the big ups and downs. But
Mhm.
when you got a big up or down, you can use sensory to de-escalate. That's the word I'm looking. You can
Yes.
use sensory stuff better than words. Words don't work very well for de-escalate.
Yes.
But sensory is probably your best tool for de-escalation. And the
In
mirror
fact, it's the
neuron.
worst. The auditory part of the brain is not online when a child is stressed. So telling a kid to calm down is one of the worst things.
Well, hey, if my spouse tries that when I'm upset, that doesn't work well.
But But wouldn't it be helpful for parents to know this? Don't say anything. Turn off the lights, decrease that visual input, bring them to a safe space, sit with them and co-regulate with them. Don't say anything, I could have used that years ago with my own kids.
I was gonna say it sounds easier said than done sometimes.
does.
When I'm in the
Yeah.
moment, I need my own
Well, but-
sensory diet. I'm like, whoo.
The other thing though that you said, Heather, that was really important is when this kid was there, you were scared at first, but then you self-regulated.
Yes. And as an adult with a mature brain, I can do that, right? I've developed my pyramid, so I had those tools,
Yeah.
right?
But
So
it makes sense that at first you were dysregulated, because that
yes.
is dysregulating. But then you were able to self-regulate, and then then you were able to co-regulate your child,
Mhm.
and he was able, well, that child and he was able to
Yeah.
come through.
And then, kids are able to like talk about their feelings in psychotherapy. So that's why OT and psychotherapy are just it's a beautiful marriage between two professions. One's working on the body and the brain. The other one is working at a higher level, right? Like the function, the cognitive level, as you mentioned, right, Tanya? You're working in conversation. And so, but if we don't have regulation, that cortical part of the brain is not really paying attention. So you don't absorb the information. Yeah.
Okay, we're over time.
I know. Thank
I'm
you
sorry.
guys
Yeah.
so much. I really appreciate this information.
Thank you
I'm
so much
frozen
for
again.
having me. I'm really passionate about this topic. And yeah, I was excited to hang out with Tanya tonight. We work well together and we know her very well. So thank you so much.
Oh, Catherine just totally froze again. But we understand that people probably have to go, and we will get this recording to you. And I'm pretty sure when she comes back on, she's going to stop the recording. But I bet you she just popped out. So if anyone has another quick question, but we both have to go pretty soon too. So I don't know if I can, I wonder if I can turn off the recording. Nope. That is Catherine's control. And she's gone. There we go.